From WRL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Monday, December 7th, 2020. I'm Ken Smith. This week, all eyes will be on the first coronavirus vaccine, which could get FDA approval as soon as this weekend. Duke Infectious Disease Specialist Dr. Cameron Wolfe shares his thoughts about the vaccine, distribution of it, and what we all need to pay attention to until then. We'll have tens of millions of doses of Pfizer's vaccine by the end of the year. Is this a realistic timeline?
Well, I think the timeline of certainly having vaccine out this year is now accurate. We are planning that is likely to come within perhaps as soon as next week for some of our sort of very first individuals. So I think the timeline's accurate. We'll need to see what the actual numbers are when they get delivered. They obviously have to be separated amongst all the different states and then trickle down to each of the different hospitals. But I think the timeline is now accurate. So it's a hopeful light at the end of the tunnel, to be honest.
Yeah. Of course, the FDA committee meeting this week that could approve the virus. What challenges do you see as many of these states start their rollout strategy?
Well, I think there's a few. So the first is we've got to be very clear on how we're prioritizing the vaccine. So it's distributed very intentionally to folks who both have the highest exposure of COVID first, and those who are mission critical to sort of keep hospitals open. Then almost in parallel to that, our highest risk individuals who live in nursing homes and staff nursing homes, because that's where all of our mortality has been seen this year. And just physically getting those vaccines to people is the challenge. So how do we've been sort of spending a lot of time, and I know other hospital colleagues around the country have too, getting those lists ready, starting to notify people about who's sort of first in line, planning our own logistics about getting tents and clinics ready, having pharmacy prepared for vaccines that are actually needed to be kept at ultra cold storage temperatures. And then simply getting the transparent message out that actually these look really safe so far, and that, there's things that we know and things that we don't know, and we want to be really clear with people about what this all means. But to be very clear again, this is the efficacy here of these two vaccines is outstanding, and that I think makes the job of explaining to people why this is so important that much easier. They're wonderful vaccines that so far have passed all of their safety tests. So it's a very optimistic short-term horizon, actually.
Yeah. Dr. Wolfe, the decision to who gets the vaccine first is being left up to individual states. We've had Dr. Mandy Cohen on this morning saying that first responders in our state will be first in line. What's your perspective on that rollout strategy for North Carolina?
Oh, I think it makes a lot of sense. I mean, I think the people who need to keep our sick patients getting the care that they need, to be frank, are the people who run sort of emergency response, urgent cares, intensive cares. They're people who, by definition of their job, are not only exposed every day to COVID, but are important for us to deliver healthcare in a way that's crucial in the middle of a pandemic when our cases are still going up. So that's absolutely ethically and morally the right way to go. I have no qualms with that. It's a good choice.
Well, you just mentioned cases going up here in North Carolina. Do you see additional restrictions needed to curb the spread of this virus?
Well, I'm not the politician, fortunately, so it's not my call ultimately. But if I had to give a message to people, it's in the same way that our cases have surged up after Thanksgiving. We have another congregate activity coming in Christmas in a few weeks. And I'll be honest, if I could implore people right now to consider their travel or reconsider the need for their travel at that time, we've got consistently more than 2,000 to 2,500 deaths per day in the United States. That's an awful number, and that is going to get worse. And so we have a very, very optimistic light at the end of the tunnel here with the vaccine, but to roll it out, it's going to take us a couple of months. I don't want to be white-knuckling through January because we didn't have enough patients to get through Christmas. So will that require some more sort of rules on the book, or is that something that we can just all get together and figure it out without the need for rules? That's up to our community. But my goodness, Christmas gives me some concern, and we need to be careful about it.
This has been your North Carolina Coronavirus News Brief for Monday, December 7th, 2020. Let us know what you think of the podcast. Leave a rating or review wherever you listen, and be sure to subscribe so you don't miss a new episode. I'm Ken Smith. Thanks for listening.